Hey everybody, April here with Cannabis Care Team. So today I am sporting a little swag. However, I don't, promote any particular cannabis company. I don't encourage patients to go buy a particular thing or go to a particular place. But I just really like to wear this hat. It's comfortable. However, this hoodie that I'm wearing was created by an artist in Kansas City. He's a veteran. He's an awesome guy, and I really love the work that he does. I do wear his hoodie in my sunroom because it's really cold in here. So staying warm today. So adolescence and cannabis use, if you read anything about my story, you probably know what brought me to the medical world of cannabis. And that was my son, who was an adolescent at the time, suffered an injury. We had tried all the other treatments and really found that cannabis was the only thing that worked for him. So 90% better. A couple years later, of course, we were doing this legally. We live in a medical state. So when it comes to cannabis and adolescence, first remember that the brain is still forming until someone is the age of 26. So we want to protect that brain as much as possible while it's still forming. I mean, brain development. I mean, there's so many things that are going on in there, right? We want to make sure that we're giving our kids the best chance possible. We want to make sure that they can develop healthy relationships in the future. We want to make sure that they can stay focused on certain things in the future and, really live the best life possible. So we want to protect that brain. The best way to do that with cannabis, and this is not medical advice, but we know that CBD does provide so many neuroprotective benefits. So it protects the brain, and that's what we want to do. There's a lot of research out there that indicates that CBD could be, in the future, we could be taking CBD to prevent things like Parkinson's, Alzheimer's, Huntington's. I mean, there's so many things that it has the potential to do. It could really help patients with MS. We don't have all the answers, but I think, in 50 years, we probably will. So we know what it can do. It protects the brain. So if a child or an adolescent or anyone under the age of 26 is going to be consuming THC, according to the research, that person needs to be consuming CBD along with that. There's not enough studies out there to show what THC is going to do to that adolescent brain. We do know that adolescents who start consuming cannabis are more likely to suffer cannabis use disorder. There's another video on that. There's some research that indicates that cannabis use among adolescents could potentially lead to some psychiatric conditions. I am not going to speak to that because I haven't seen any research that says that's given me that's given me enough information either way. So of course, number one, always talk to a doctor about potential concerns regarding medical cannabis and potential side effects. So CBD is a big one for adolescents. Cannabis use disorder, of course, is something that people want to be aware of. But just helping that adolescent reach their goals. So that's what I always do with patients. Is that adolescent trying to address anxiety? Is that adolescent trying to is it a seizure patient? I mean, there's so many different things out there that cannabis or CBD has been shown to improve. So, what are those patients' goals? And then, a lot of times when I'm working with patients, never giving medical advice, but we're talking about, the other things that they can do to improve their endocannabinoid system. So if cannabis is not an option, if CBD is not an option, we're talking about diet, exercise, laughing, playing, smiling, all those important things that, promote those endogenous cannabinoids, that our body produces itself. If we can't take them, from a plant, we need to get our body ramped up so it's making enough of those to do all the wonderful things that they do. So adolescents and cannabis, just a quick video. If you need a referral or a local resource to a physician who understands pediatrics or adolescents and cannabis, please, of course, you can call or schedule a 15-minute consult for free on our website, cannabiscareteam.com. Just wanted people to be aware that, cannabis is so medicinal and has so many benefits, but we just need to be cautious with these younger people. Everybody, thank you so much for watching as always, and I'll see you soon. Bye bye.